Have you ever imagined what it would feel like to wake up in the middle of a surgery? You're supposed to be unconscious, unable to feel or remember anything. But instead, you hear the clinking of metal instruments. You sense people moving around you. And maybe you even feel pain. But you can't move, you can't speak. It's like being trapped in your own body. This terrifying experience has a name: anesthesia awareness. And although it's rare, it's very real. So what exactly is happening here? Why do some people become conscious during a procedure that's supposed to shut down their awareness completely? And how are doctors trying to prevent it? To understand that, we have to look at how general anesthesia works. When you go under for surgery, anesthesiologists typically use a combination of drugs. One to render you unconscious, another to block pain, and often a third to paralyze your muscles so you don't move during the operation. This carefully balanced cocktail allows surgeons to perform complex procedures without the patient being aware of anything. No pain, no memory, no sense of time. But general anesthesia isn't the same as just being asleep. Sleep is a natural process where your brain still cycles through different phases and remains partially alert to the outside world. Under anesthesia, your brain is essentially disconnected. It doesn't process sensory input the way it normally would. That's the goal. So when something goes wrong and you become conscious during surgery, it means that this disconnect hasn't fully happened. Your brain somehow is still receiving and interpreting input, even though your body is immobilized. Now here's the thing. Anesthesia awareness is very rare. Estimates suggest that it occurs in about 1 to 2 cases per 1,000 surgeries involving general anesthesia. That's less than 0.25%. In most modern hospitals with highly trained anesthesiologists and advanced monitoring equipment, it's even rarer. But when it does happen, the effects can be severe. Not just physically, but psychologically. Some patients who experience anesthesia awareness report vague sensations, like hearing voices, feeling pressure, or a sense of time passing. Others report excruciating pain and the inability to cry out or move, which makes sense because the paralytics used in surgery block your muscle activity, including facial muscles and vocal cords. The result is a kind of waking paralysis. Patients may scream internally without being able to make a sound. For many, the experience leads to post-traumatic stress, anxiety, and long-term sleep disturbances. By the way, if you like this content, remember to subscribe and like. It's free, but why does this happen in the first place? One common factor is emergency surgery. In trauma cases, say after a serious car accident, patients may arrive at the hospital with dangerously low blood pressure or other complications. Anesthesiologists must walk a fine line, use too much anesthetic, and the patient's vital systems could crash. Use too little and awareness might creep in. In these cases, the priority is keeping the patient alive, even if it means accepting a higher risk of awareness. Another factor is individual variation. Not everyone responds to anesthesia the same way. Some people naturally require higher doses due to genetic differences in how they metabolize drugs. People with a history of substance use, especially alcohol, benzodiazepines, or opioids, may have developed a tolerance that makes them less responsive to standard doses. Similarly, people with certain medical conditions like heart or liver disease may process anesthetic agents differently, complicating dosage estimates. Then there's the risk of equipment failure or human error. Modern anesthetic machines are usually very reliable, but they still depend on correct settings, adequate drug supply, and constant vigilance. If an IV line becomes dislodged or a machine runs dry, the flow of anesthetic may stop without immediate detection, especially if the patient is already paralyzed and unable to respond. So how do anesthesiologists reduce this risk? They monitor everything: heart rate, blood pressure, oxygen saturation, respiratory rate. All of these can provide clues that a patient is not fully anesthetized. But none of them is perfect. For example, a patient might remain motionless with normal vital signs even if they're aware. because muscle relaxants mask any outward reaction. To go further, many hospitals now use brain monitoring systems, like BIS, or bispectral index, monitors. These use EEG technology to track brainwave activity and generate a score that estimates the patient's level of consciousness. A score of 100 means fully awake, while a score between 40 and 60 is the target range for general anesthesia. While these devices aren't used in every surgery, they're more common in high-risk or long procedures. They provide an additional layer of safety, helping anesthesiologists titrate the right amount of medication in real time. And there are more layers. Before surgery, patients are typically asked about their medical history, drug use, prior surgical experiences, and any reactions to anesthesia. All of this helps anesthesiologists anticipate potential complications. That's why it's so important to be honest and thorough during pre-op evaluations. Your answers can literally change the drug plan that's used to keep you unconscious and safe. One more thing that's worth knowing. Not all cases of awareness involve pain or trauma. Some patients report awareness but describe it as a detached experience, like hearing music or voices but not caring. Others even recall dreaming or having hallucinations. In fact, researchers are still learning about what kinds of brain activity persist under anesthesia and how they relate to memory formation and perception. In some rare cases, people remember parts of the procedure but don't form emotional trauma. In others, the psychological impact is profound. That's why follow-up care is so important. Patients who report awareness are often offered counseling, support, and, when appropriate, referrals to trauma specialists. So let's bring it back to the original question. Why do some people wake up during surgery? The answer is a mix of medical complexity, biological variation, and the limits of technology. Even in the safest environments with the best equipment and highly trained professionals, rare anomalies can occur. But thanks to ongoing research and technological innovation, anesthesia is safer than ever. And now, if you're heading into surgery, you know what's happening behind the scenes. You know the risks are low. You know the signs doctors watch for, and you know that being informed is one of the best ways to stay calm. Anesthesia awareness may sound like a nightmare, and yes, and for a small number of people it has been. But for the vast majority of patients, surgery under general anesthesia remains a completely unconscious, pain-free experience. If you've ever experienced this or know someone who has, share your story in the comments. We'd love to hear from you. And if you found this video interesting, make sure to like, subscribe, and hit that bell so you don't miss the next deep dive into the mysteries of the human body and mind. Thanks for watching, and stay safe.